geriatric pharmacist.
Oh, that's wonderful, yeah. We might be over to see you.
Yeah, you guys can come see me anytime.
And I'll just mention to you that Mary Bridgman is associated more with Robert Wood Johnson down in the Piscataway area. And because of different things going on at Rutgers, she has a change of schedule today. And Lucio Folino is on his way. I have to check my phone to see if he's actually on his way right now, but he should be here soon. And he's a wonderful person. I was looking up his information, and I'm looking at all these things, and I see that he was the Professor of the Year at the School of Pharmacy at Rutgers for like 6 years in a row.
Yeah, he's awesome.
Yeah, he's awesome. That's who he is. And when you see him, you'll know he dresses in a way that really makes it feel like fun. And he happened to say that this was his favorite student, his best student right now. So she will begin the presentation. Maybe what we could do before we begin, should we ask you to move your chairs up a little bit so we can see them?
All right, so hi everyone. Thank you so much for coming today. The exercises were great. You guys did a great job. So now let's talk a little bit about bone health and you. First of all, how many of you have osteoporosis? All right, so a good number. So this will be a great class for you. We have some tips on how to treat osteoporosis and how to manage it with lifestyle modifications. So first, throughout our presentation, we're going to recognize why bone health is important. We're also going to talk about those lifestyle modifications for prevention of osteoporosis if you don't already have it. We're going to learn about treatment options, and then we're going to evaluate strategy for preventing falls, because as we know, falls can lead to fractures, and we want to make sure we prevent that as much as possible. So can anyone tell me what osteoporosis means to you? Just shout out words that are associated with osteoporosis.
Loss of bones.
Thinning of the bones, loss of bones, great. Anyone else? Fractures, yeah. So basically it's a decrease in bone mass, which can lead to fractures being able to form more easily. So the Greek meaning of the word is osteo and porosis, and that literally means that the bone is spongy. And as you can see here on the left side, that's the normal bone, and on the right side, it looks a lot more spongier, and that's how osteoporosis happens. Osteoporosis has about 2 million fractures annually, and this results in about 500,000 hospitalizations per year and almost 2.5 million medical visits. So it's very prevalent, as we can see from these numbers. So how many people have osteoporosis? There's about more than 10 million Americans are estimated to have osteoporosis, and about 8 million of them are women, so it's a lot more common in women than it is in men, with only about 2 million men having osteoporosis. And there's over 1.5 million fractures attributed to osteoporosis annually. So let's take a closer look at the bones. There's two classes that we have. So there's something called osteoblast, which is responsible for forming new bones. And there's something called osteoclast, which is responsible for breaking down the bones. Now, ideally, we would want a fair balance of both. We want the osteoblast to form new bones, and we want the osteoclast to break down the bones, that way the bones can be regenerated. Now, where osteoporosis happens is if we have too much of the osteoclast, which means the bones are broken down, and not enough bone building. And this is what results in osteoporosis. So, now we talked a little bit about rebuilding of bones and constant recycling of bones, but why are bones important? So bones have many functions. They store nutrients and minerals. They're involved in a lot of blood cell formations. They also provide protection of internal organs, and as we know most commonly, they help us facilitate movement. They're responsible for having us move, jog, run, etc. So in order for us to figure out whether we have osteoporosis or what our bone health looks like, there's something called a bone mineral density testing. How many of you have heard about this?
We have this.
Yeah, great, exactly. So that's usually done by something that's called a DEXA scan, and a DEXA scan measures the bone density and the mineral content that's in your bones, especially things like hips, your wrists, your spine, and then that's being compared to either people that are your age or people that are younger than you, so the general population. DEXA scans are usually useful for monitoring and screening for whether you have osteoporosis, or if you are on therapy for osteoporosis, it's useful to monitor whether the therapy is working or not. So this DEXA scan is usually suggested for women that are greater than 65 and men greater than 70 years old, those that have a history of bone fractures, or younger populations such as women between 50 and 64 years old, and men 50 to 69 that have an increased risk of bone loss. So this includes people that have already had fractures, people that are on certain medications, which I'll go on into a little bit. So let's understand the bone mineral density test. So if you do this test at your doctor's office, the result that comes back is something that's called a T-score. Have you guys heard of a T-score? Yeah, exactly. So if we look at this ruler over here, we can see that the normal, which is on the right side, is between a -1 to +4. Now, if your score is between -1 to -2.5, that means you have osteopenia. So it's not yet at a level of osteoporosis, but there's low bone density. Now, osteoporosis happens if you're at -2.5 or greater. So this means that you have those porous bones and you're more likely to have the fractures. What are some risk factors for osteoporosis? Can you guys shout some out?
Menopause.
Menopause, great.
Alcohol.
Alcohol, medications, yeah, so excessive alcohol use, smoking can also be a risk factor for developing osteoporosis. Certain medications, which I have a whole slide that I'll go into it a little bit later. Menopause, so usually women greater than 50 years old, once we go into menopause, we have that greater risk because we have low estrogen levels. Family history, so if you have a family history of osteoporosis, you have a greater risk for developing it. And then low body weight, so the thinner you are, you're more likely to have less bone mineral density, you're more likely to break your bones. And then certain ethnicities, so white people, Caucasian people, and Asian people are more likely to have osteoporosis compared to other ethnicities.
Could I ask you a question?
Yes.
Do you know why that's true? I've often wondered about it. I know the Caucasians, Asians, is there any reason for it? Is it related?
That's a great question. Yeah, I think it's probably related to the way our bones are and the building over the structure in those certain special populations, but I'm not really sure it's exactly what the reason is, but it's an interesting point, right? Yeah. So now moving into some medications that can increase the risk of osteoporosis. So we have our stomach acid reducers that are usually over the counter that are used for GERD. So this is our Nexium, our Prilosec, or Protonix. And sometimes a lot of people get started on these medications for GERD or other reasons. So if you're on certain pain medications for a prolonged time, your provider might start you on it in order to decrease that risk of bleeding. However, if you take them for a prolonged period of time, you might have osteoporosis. Now, if you're taking this, it doesn't mean that you should stop it right now, but it's something to talk about with your doctor just in case you've been on it for a long period of time, and they can tell you what you can do in order to reduce the risk of having osteoporosis. Some other medications include steroids, so a lot of times for people that have chronic asthma, they can use steroids. A lot of people with pain issues could use steroids, so prolonged use of those can contribute to osteoporosis. And then certain anti-seizure medications, so Dilantin or Depakote, long-term and high doses of these medications can dispose you of having a risk of osteoporosis. So the take-home point from this is don't start or stop any prescription medications before talking to your doctor or talking to a pharmacist. If you are taking any of these medications, it's important to bring it up to your physician, have a conversation, and then make the best decision for you. Go ahead.
Do thyroid medications have an effect?
Yes, so I have a little slide about that later on, but yes, you could have an increased risk of having osteoporosis with thyroid medications.
And Ljubica, since we talked about some of these things in the morning class,
Yeah.
I think it's interesting that some of these medications are new to the market, so to speak, so that there's a greater likelihood of people developing osteoporosis now because of the use of the medications. Our parents never had access to these medications.
Right.
So they're the pros and the cons. At least we have those medications available, but they carry certain risks of reducing the density of our bones.
Right, exactly. But to add to your point, people are now living a lot longer compared to your parents, and that also increases the risk of developing osteoporosis. So then how do we prevent bone loss and complications? The biggest thing is preventing falls, because falls can lead to fractures, and then we have a lot more complications. So we'll talk a little bit about fall risk reduction in the next slide. but also exercising. So you guys did some exercises today. Being a part of the Healthy Bones is really important because you're getting that exercise that helps you maintain healthy bones. Healthy diet and using dietary supplements, and then also smoking cessation and limiting alcohol use like we talked about previously. So I have a picture here, so let's pretend this is someone's home, and I want you guys to tell me what are things that jump out at you that could be a fall risk.
The rug.
The rug, exactly, yeah, that rug needs to go. What else?
The cord.
The cord, yeah, there's a cord right by the TV, so that's a fall risk right there.
Stuff on the floor.
Yeah, there's a lot of stuff on the floor. There's like newspapers, there's a remote on the floor. What else? There's one more thing that's a little less obvious with the chair.
The chair.
Oh, the wheels.
The wheels on the chair, yeah, so if you're trying to sit down, you can just roll over and like fall right there. So this is a great way, it took us about a few seconds to identify these things, so when you go home today, I want you to identify any fall risks that you might have, that way you can prevent falls. Okay, so yeah, so keeping the floors free of clutter, avoid walking around in socks, so that could be an easy slip, so using slippers would be preferred. Checking carpets that are, make sure that they're all tacked to the floor, keeping electrical cords out of the way, and then make sure that your stairs have handrails. Yes.
You know, when I saw that, I realized that if I go to get a colonoscopy or a mammogram or whatever, you know, I have to take my shoes off.
Right.
You don't just walk around in your bare feet or your socks. What do they give you now?
The paper.
Yeah.
Paper
It's got
shoes.
little discs on the bottom so that you're not like this.
Non-slip paper shoes.
Yeah, usually we use those in the hospital as well, and patients are admitted that way when they're walking around, we reduce the risk of falls. So now we're at the slide with the medications that are potential for high fall risk. So are you guys aware of any medications that could potentiate high fall risk?
The muscle relaxant.
Muscle
they
relaxants,
always
yep.
over the
Yeah,
time.
so there's a lot of classes on here, but the general point is that medications that might make you feel dizzy, medications that might make you feel confused, medications like muscle relaxants, if you take it, you go to sleep right away, and then when you wake up, you might still feel groggy. Certain pain medications, blood pressure medications, if they drop your blood pressure too low, they could be a fall for risk, or risk for fall. So I think it's important to just reassess the medications that you're on with your physician, and make sure that if you do experience some dizziness, or if you're having certain problems with your medications, talk to your pharmacist or your provider. That way we prevent any fall risks. And of course, do not start or stop any medications without talking to a provider. Now, looking at exercise, I know you guys did some great exercises today. What are some other exercises that benefit bone health?
Walking.
Yep.
Line dance.
Yep, line dancing. Yeah, so like swimming, bicycling, Tai Chi is very popular, strength training. Those are all great exercises to keep your bones healthy. Some things that you might want to be cautious with, like skiing or skating, we don't really want to do that because you're more likely to fall and break your bones. Also jogging or jump roping could put you at a greater risk. But yeah, activities that kind of require you to twist the spine or bend forward, we want to lay low, and then just do the things that are on the left side because they help us maintain our healthy bones.
Yeah, and to build on that a little bit, everybody who lives in Livingston is very fortunate to have this wonderful senior center.
Oh, yes.
And it's not only the building, it's the programs that they have here. There are things like chair yoga, Tai Chi. So some of these exercises that are good for keeping you flexible without putting too much strain on your joints or whatever are wonderful to have available to residents.
Right, so take advantage of that when you can, for sure.
For those people who don't want to come to a class here, I've discovered on the YouTube, there's a Don Fiore 9-minute Tai Chi that almost anyone can do. It's great.
Well, thank you for sharing that. Yeah, that's definitely helpful for people that can't come in.
Right. Could I mention one other thing that makes me think of what you just said, G? In the state of New Jersey, you can go to a website that's called Get Set Up. And it's a program for seniors who are teaching other seniors. It's on 24 hours a day because it's a global program, and it has a lot of programs on exercise, but also on art, all kinds of things that keep you mentally alert as well as physically alert.
Oh, yeah. Thank you for sharing that with me.
Get set up. It's like get set up for something exciting. Yeah. So it's GETSETUF. Yeah, we wish they had it.
I really, I could
Yeah, I'm gonna go home and look it up just to
I
see how
broke many
many
bones from falling, just recently.
That's terrible. But I'm glad you're here, so you can prevent other fractures from happening, right?
Right.
So speaking of prevention, so we have a normal bone density and then we have the osteoporosis that we talked about. So normally, if you do have a normal bone density, a balanced diet is enough to maintain that bone density. However, if you do have the osteopenia or osteoporosis, a balanced diet alone is not sufficient and you might need to add supplementation or even prescription medications in order to help maintain your healthy bones. So speaking of supplements, calcium and vitamin D are our go-to supplements. They preserve the nerve and the muscle function, and they're used in prevention as well as along with osteoporosis treatment. So the way that calcium works is that they make the bones strong, and the recommended dose is between 1,000 to 1,200 milligrams per day. And vitamin D works together with calcium in order to help calcium absorption so you can have that stronger bone. The vitamin D recommended dose is about 400 to 2,000 international units per day. So talking about diet, there's something that's new about the nutrition label. So before, when we look at the calcium, let me just highlight that. So when we look at the calcium content, before it used to just tell you the percentage, but now it has the actual number. So you can keep track of how much calcium you're getting. If it doesn't have the actual number, a trick, like an easy way to do this, if you just see the percentage, you just add a 0 to it, and that kind of estimates how much calcium you're getting. So 20% if you add a 0, that's about 200, and the actual content is 260, so it's pretty close. So yeah, now it's easier to identify the number of calcium milligrams in servings of food, and something to consider is adding up the amount of calcium you're getting so you can see if you need the supplementation or not. So some things, like common things that have calcium, include a lot of dairy. So about 8 ounces of milk has about 300 milligrams of calcium, 8 ounces of yogurt has 400 milligrams of calcium, and 1 ounce of cheese has about 200 milligrams of calcium. You would want to add up all these values, and then usually you get about 250 milligrams of calcium from non-dairy sources like cereals or juices. And then this would be your total daily intake of calcium. Now, the recommendations for dietary sources of calcium is about 3 to 4 servings per day. So what are some foods that are high in calcium?
Seashells.
Spinach, seashells, so those like dark leafy greens, a lot of dairy.
Can I just ask, are you going to be giving out any brochures with those amounts down, or we should be writing everything down?
I don't know if you want to share it.
Jean, if you give Walter or me your email address, I'll send you that.
Yeah, you can, yeah, Sally can email the slides to whoever
It might
wants.
not be just me who wants it.
And I'm sorry to come up here again, but there's something wonderful that's going to happen. You know, we think of the National Osteoporosis Foundation as looking out for us, but I've only recently become aware of the International Osteoporosis Foundation. They are having their annual meeting in Barcelona from May the 4th to May the 7th. And they are going to launch a new website that is so user-friendly. And they give you all of those different ratings of calcium in food, ways to immediately calculate how much you're getting in terms of your daily diet. And so that'll be available in about 2 weeks. And you would say that it was written by your children, you know, that they were having fun playing, you know, with this. It is full of animated figures, all kinds of wonderful information. So it's not that we have to go back to looking at a chart. Remember, it was always black and white, you know, this equals that, and so on. Now it's at least with color, like blue in the background. But it will be available in a very, very easy way to use. It's almost like a revolution. It's going from one age to the other, agriculture to the Industrial Revolution or something like that. So when it comes out, I'll send it to people.
Yes.
Yeah, but in any case, yeah, don't worry, I'll remember, because it is really so good. So Jean, if you keep in touch with Walter, who invited you to come today, or me, we can send that in. It'll be available universally. It's a
Too
big,
bad you
big.
couldn't have gotten this big.
Yeah, you go
That
to
was-
I know. They asked me for a certain reason if I would preview it, and I was saying, oh, maybe they'll ask me, but they didn't ask me. Yeah, I should have volunteered.
So yeah, you can use that website to kind of track your calcium,
Yes,
but
yes.
some foods that have the most amount of calcium include dairy, so like yogurt, milk, and cheese have a lot of calcium. Certain proteins like tofu or sardines, those oily fishes have a lot of calcium and vitamin D, and then those dark leafy vegetables. And then other foods like mineral water, dried figs, a lot of juices have fortified calcium. Now let's talk about calcium supplementations. The two most common types of calcium include calcium citrate and calcium carbonate. Calcium citrate usually has less side effects because it doesn't require that acidity in order for it to be active, so you can take it with or without food. Calcium carbonate, however, has to be taken with food. It is less expensive, but then you have that burden of having to take it with food. So it's a risk versus benefit, or your personal preference on what exactly you want to take, whether you want to take it with food or if it doesn't matter to you on how you want to take it. So maximizing the calcium intake, we know that, as we mentioned, a lot of dairy has calcium, a lot of those juices and bottled water have calcium. There's also alternatives to these things. So if you can't swallow those large pills of the supplements, there's chewables, there's also chocolates. But something to keep in mind, if you're diabetic, you don't want to be eating a lot of those, so pills might be better for you. And then if you're taking a lot of medications, there's also combination pills. So aspirin can also come with the calcium inside, so you're taking one pill instead of taking two pills. Or there's a lot of fiber that comes with calcium as well. And then something else to think about is the common drug interactions that come with calcium. So we have both over-the-counter medications that interact with calcium as well as prescription medications. So for over-the-counter, we have multivitamins, phosphate, as well as iron supplements. And then for prescription medications, we have certain antibiotics that you might use for like an upper respiratory infection, levothyroxine, so a lot of our thyroid medications. So you might require spacing with the calcium if you are taking levothyroxine. And then some of the medications used for osteoporosis, like the Minova or the Fosamax, and then certain HIV medications. So if you're taking these certain medications, you probably might need to separate the calcium supplement from those medications. So the best thing to do is to talk to your pharmacist or a provider and let them know what medications you're taking. That way they can check if there's an interaction between the two, and they might counsel you to separate them a few hours before or after. And whenever you're starting a new supplement or anything new over the counter, just make sure to talk to a pharmacist or your doctor, because they'll counsel you on whether you need to separate it or not. Because there's a lot of medications that might interact and you can't really remember everything off the top of your head. So that's why it's important to always stay in touch with a healthcare provider. Okay, now moving on to vitamin D. So as we mentioned, vitamin D is really important for that bone formation. It helps dietary calcium as well as phosphate absorption from the small intestine, and it also maintains the normal mineral homeostasis. It's mostly found in milk and milk products in the United States. We can also find it from the sunlight. However, living in New Jersey, we only get that about a few months a year, and we don't want to be in the sunlight all day because we want to prevent skin cancer. So you could get that a little bit from the sunlight, but we may mainly get it from diet as well as supplements. So what are some sources of vitamin D? So as you mentioned, sunshine, that dietary intake of dairy and milk, and then supplements. Okay, so this might look a little bit confusing, but it's basically a picture of how vitamin D is activated. So as we said, vitamin D can either come from the sun or it can come from dietary consumption. So then vitamin D goes through the liver and the kidney as well. It gets metabolized there, converted to an active form, and that's how it goes to the bones in order to help maintain healthy bones. Just a disclaimer for people that have liver or kidney diseases, you might need higher concentrations of calcium in order to maintain those healthy bones, but that's something that you should discuss with your provider. And then, as we mentioned, calcium and vitamin D come in a lot of preparations. There's the pills, there's the chewables. They have a mini pill if you're not able to swallow the large pills, and then they have the liquid form as well. Now, talking about vitamin D products, so there's a bunch of vitamin D products out there. In a multivitamin, if you take a multivitamin every day, there's about 400 international units inside. Vitamin D comes between 400 and 2,000 international units. However, if you're vitamin D deficient, your provider might put you on something that's once a week, like a 50,000 units. So you take that once a week in order to help get to that level where you can switch over to the daily vitamin D supplement. And then vitamin D comes both in ergocalciferol, which is vitamin D2, and cholecalciferol, which is vitamin D3. The D3 is our preferred agent for vitamin D because the D2 is less effective at depleting those vitamin D stores if you already have vitamin D deficiency. So now we can talk a little bit about the classes of osteoporosis. The main point is to reduce the bone loss. We want to maintain the bone density and prevent fractures, prevent disability, and overall just emphasize bone health. So there are a lot of drugs that are out there. I won't go into too much detail. However, some of our classes that are most commonly used include bisphosphonates and denosumab or Prolia, which I'm sure a lot of you have heard about. And then we have certain parathyroid hormones because parathyroid hormones are involved with that vitamin D and calcium absorption. So these are the top two classes that are used for osteoporosis treatment. We have the anabolic medications, which stimulate the body to make the bone a lot quicker, and they increase bone density. These are medications such as Tymlos and Forteo. And then the other class is called anti-resorptive medications. These slow the breakdown of the bone, and they improve the bone density. And these are more the bisphosphonates or the Prolia. So what are the benefits of these osteoporosis drugs? So as we can see here, out of 1,000 people that are on osteoporosis medications for 5 years, less than 1 person might have a jaw problem, and less than 1 may have a rare treatment-related fracture. So the benefit is a lot higher than the risk. And for every 100 women taking a bisphosphonate for 3 years, only 6 will avoid a fracture. And protection is best for the fracture of the spine, but it's also significant for the hip. So as we can see, benefit is a lot larger versus the risk. And then talking about risks, as we can see, out of 1,000 women, only 500 will suffer a fracture without treatment for osteoporosis. And then long-term treatment with bisphosphonates, usually more than 5 years, has been linked to some side effects. So typically, if you're on bisphosphonates, you'll be on them for 5 years. Most of the time after that, your provider will take you off or they'll switch you to something else in order to reduce those risks. And then just something else to mention, as you all might know, medication adherence is key because we want to make sure we're taking the medications to help keep those bones healthy and treat the osteoporosis. So some of our medication options that I talked about include Fosamax, Reclast, or Prolia. Our second line options include Forteo, Tymlos, Boniva, or Livingston. You guys might be familiar with these if you're on them. And then depending on your medical history, your bone mineral density results, and your risk versus benefit, your provider might choose a different medication for you.
I see that this is an important slide. I didn't realize it this morning. So the options for osteoporosis. So the first ones that are recommended are Fosamax, Actonel, Intelvia, Reclast, and Prolia. Who makes that decision as to those being the first? Here's what I have in mind. Who makes that decision?
Yeah.
Because those are not the ones that are best for bone health. Is it the insurer? Because they won't allow you access to one of the anabolic medications right away?
So typically, there is the guidelines for osteoporosis, and these guidelines are based on clinical trials that are performed in individuals with osteoporosis. So the initial therapies, second line therapies are mostly based on the clinical trials, and that's how the guidelines make their decisions. Yeah, and usually with the insurance, there's preferred drugs, and then there's drugs that are not preferred, but typically the provider will go based off of the guidelines and the clinical
I
trials.
see, okay, good.
Yeah, yes.
Years ago, I was put on Fosamax and taking it, and after about a year and a half, they told us to stop taking it. There was a problem. How has that been corrected? Because it's the same drug, isn't it?
What was the problem? I'm not really familiar with the.
I don't remember that.
Well,
My doctor said with
The chin, yeah, so as I mentioned, treating osteoporosis, so
why did they take me off of it?
I'm not sure what your doctor, saw. I'm not sure if you were having any side effects from the medication itself, but I know there's a lot of people that are on Fosamax that are doing very well.
Actually, it wasn't that, it was Celebrex at that, sorry.
Okay, so yeah, that's very different, but thank you for bringing up that point.
Gee, that's a relief because there are too many complaints about our medications.
I couldn't remember.
So in conclusion, I know we went over a lot of information. Osteoporosis affects millions of people globally, and some of you said that you yourselves have osteoporosis. So education is really important. We want to recognize the risks for osteoporosis, and we want to make sure that we're preventing and taking the initiative to prevent osteoporosis. So making sure that you do the exercises, making sure that you're talking with your physician when it comes to those increased risk medications that might cause osteoporosis later on. So that is all I had for you today. Do you guys have any questions at this time?
I read a study about prunes helping lessen in the hip, bone loss in the hip, 5 to 6 prunes a day. Do you have any comment on that?
So I know prunes are fortified with calcium inside, but I'm not really too sure about the literature and if there's actually clinical trials done in order to show that it can reduce the risk of osteoporosis. But that's something to look into.
Okay.
Yeah.
My second question is, what about vitamin C? They always mention calcium, but I just read that vitamin C is also very important. I was wondering if you have any comments.
Yeah, so I don't know if there's any correlation between vitamin C and bone health directly. The two most important supplements that we use for osteoporosis is vitamin D and calcium. There might be something upcoming with vitamin C, but I'm not really aware of it.
Okay, and the calcium, when you're taking that calcium supplement, I'm not sure if mine also has the vitamin D in it.
Some of them come in combination, calcium and
It does
vitamin
not.
D.
You need to take that vitamin D right
Separate.
along with the same
Yes.
time.
It doesn't have to be at the same time, no.
Oh, okay.
It can be separately. But if you do take a lot of medications, it might be helpful to have the combination. Just make
Right.
sure to check the amount of vitamin D that's inside the calcium as well.
Okay.
So, excuse me, for people on Zoom, you may have to repeat the question so they
Oh,
can
sorry.
hear. Okay, good then.
Thank you for bringing that up.
Yes, in your, excuse me, in your area of pharmacology, is there any research being done now? For instance, New Jersey we're living in a very toxic, state, okay? And breathing in all of these toxins and so forth. And I have been reading the effects, on mental health and physical health, but particularly on bone health. Has there been any work in the area of pharmacology in terms of our environmental threats, to body health and bone health? Yeah.
That's an interesting point. To my knowledge, I don't think there's been any. So for the people on Zoom, the question was, has there been any work to mitigate those environmental toxins in the environment that could affect bone health? But to my knowledge, there hasn't really been any clinical trials studying those effects, the toxins on bone health. But if there is something, if you saw something that you want to share, that would be great.
Yeah, but in terms of climate change, see, there is so much coming out now because we're in such a crisis,
Right, yeah.
in terms of climate, that the effects of all this toxicity that we're breathing in and being exposed to. And I just, just throwing it out, what is pharmacology doing in terms
Yeah,
of looking?
that's definitely
into
an interesting point and something
Yeah.
to think about, but I'm not too sure if there's anything out there right
Yeah.
now that's actually looking at the effect.
this? But I think it's, we have 10 years to
Yeah,
work on this whole.
Yeah, that's a great point. Thank you for bringing that
And then
up.
we don't need to work anymore.
Yes.
Is there any possibility that taking a lot of calcium could result in calcium deposits in your arteries?
So you want to make sure that you're taking the appropriate amount of calcium. If you take too much calcium, it might lead to kidney stones.
Yeah.
So we want to make sure that we avoid that. In terms of calcium deposits in the blood, I am not too sure about that, honestly. I don't think that's a thing, but I think the biggest risk of having too much calcium is the kidney stones.
My doctor always says to make sure you don't have enough, and the blood work does show if you have too much calcium in there.
Exactly, yeah. So if you're getting your
that's-
blood work done
blood
annually,
work,
they'll be
it'll
able to
indicate
see
that.
if you need more calcium
Right.
supplementation. Yep.
What about spreading the calcium across the day? Like, I heard that.
Yeah, so as I mentioned before, you want to make sure that it's better to take up to 500 milligrams of calcium in one dose. So if you take 500 in the morning and 500 in the evening, that's usually the recommended dose. It's better to split it up.
Okay.
Great question.
My endocrinologist has recommended 3 times a day, 400 at a time.
Yeah, that's also fine too. Yep, as long as you're
Because
splitting it up.
it's always working the body. Sometimes
Exactly.
the 1200, the slow
If you take it
release
all at once,
may
yeah.
not work well.
Yeah, sorry. The question was, is it better to split up the calcium doses during the day or just take one dose at once? And the answer was it's better to split it up. When you're taking a calcium dose, the recommendation is to have a maximum of 500 milligrams per one dose. So you can take 500 in the morning and 500 in the evening. And then someone in the audience said that her endocrinologist recommended she takes 400 3 times a day.
Could I just build on that one question? So what Franca's endocrinologist said is instead of taking it 500 and 500 or 600 and 600, 400, 400, 400 so that it's available during the day. What do you think of that recommendation? That you should be taking 1,200 milligrams of calcium every day.
That's high.
It's a
Yeah,
lot.
just, no, I'm talking about.
But that should be in combination, right, with your
That's-
foods
Without
and
the
the
That
supplements.
would
Right,
be
yeah.
that, and then your.
Exactly, but if
Excess.
you're at risk for osteoporosis, that's why your doctor might want you on those higher
Maybe
doses.
my particular
Yeah.
osteoporosis can be severe. That's what happened to me.
Right, so we're looking for 1,200 milligrams from our diet
Right.
and then supplementing what we're not getting with calcium supplements.
200
Yeah,
there.
so you don't have to eat anymore, Franca. This wonderful book doesn't have to eat anymore.
What is the effect of the radiation to the body? Example like the microwave, the television, the cell phone, anything
Yeah.
that is electronic has a radiation.
The radiation on the body? Well, I'm not too sure about the radiation, but I know if you're on your phone, if you're watching TV all the time, it probably means you're not very active. And as we said, being active is really important in maintaining those healthy bones. So stay away from the TV and make sure you're getting out, especially now because it's getting warmer outside.
Or somebody who are always having X-ray,
Yeah, so
will it
having
affect?
right, so like having too much X-rays, as they said, is not really recommended, but it's important to diagnose certain problems. So that would be a risk versus benefit discussion between you and the provider.
Vitamin D, sunshine. Okay, I read, I don't know if that's so, 10 minutes a day if the sun is out.
Yeah, so
No
I know-
more than that.
Right, so we talked a
Is
little bit
sufficient.
about this before. In New Jersey, we don't get that much sunlight throughout the year.
But in the summer.
But in the
spring.
summer, yeah, certain amount of sunlight per day is fine, but you don't want to do too much to prevent skin cancer.
In the Philippines, we don't like sunshine.
You don't
We
like
always use umbrella.
Oh, the parasol.
If you're taking levothyroxine for thyroid issues, what's the amount of time you need to separate taking your medication from calcium supplements?
So usually with levothyroxine, it does have certain absorption like problems to begin with. Yeah, so the question was, with levothyroxine, do you need to separate the calcium or the vitamin D from when you take the levothyroxine? So it's more of an absorption problem. So as you know, levothyroxine has to be taken like 30 minutes to an hour before breakfast. So you want to make sure that you're taking the calcium usually a few hours after that.
Oh, so it doesn't have to be 6 hours?
Not exactly, unless that's what your provider told you.
Well, no, I don't know where I got that information. I just heard 6 hours. I don't
Okay,
know.
yeah. I don't know anything about 6 hours, but it should be at least a few hours.
A couple of hours.
I heard 4 hours.
Four? Okay.
Okay. All right, any other questions? Yeah.
Now, I have been told that even if you sit in the sun, it's good to have vitamin D because so many of the products we use have sunblocks in them.
Right, yeah,
If that's
so
true or not.
even like some of the face creams already have sunscreen in it, which is important from preventing the skin cancer, but you probably would want to supplement either with diet or the actual supplements of calcium or vitamin D because we don't know how much is absorbed from the sunlight itself. Yeah, yeah. All right, well, thank you everyone.
So since we're talking about calcium, I wonder if I could just bring this up. Margie Bissinger had a Natural Approaches to Bone Health and Osteoporosis Summit at the end of March. So it's really just been a short time ago. And one of her speakers talked a lot about the calcium in some of our foods. And she was specifically talking about calcium in spinach. And I remember that somebody over here said that spinach was a good source of calcium. And I'm not so completely versed on this, but there are oxalates in spinach, also in Swiss chard. It turns out sweet potatoes, chia seeds, some of these things that I eat all the time thinking I'm getting calcium, that block the absorption of calcium. Has anybody else heard this? Or?
Yeah, I heard about spinach.
Yeah.
It's very hard to absorb it.
So it's good to still eat that because spinach and these other products have a lot of good micronutrients and so on. But it's not that we should count them in our spinach column, you know. They might be in our health column here or whatever there, but not so much as sources for spinach. Whereas kale, bok choy, collard greens are good sources of calcium. Now Rita is suggesting with her face, she didn't even have to say it, she's not eating that many of those types of things. Being Irish, we weren't brought up that way.
I like the spinach and sweet potatoes, and I'm not willing to lose.
Yeah, so you're still going to eat those. Okay, that's good.
All right, thank you, Sally, for bringing that point.
Yeah.
So yeah, thank you everyone so much for being here today. Great job with that.
All about information here, and we just want to give you objective information that you can take back, talk to your providers, have a conversation so you know a little bit more, and that way you're having a conversation rather than just getting information. So we hope that it helps you in your conversations with your future discussions with your providers. So thank you very much for being here. And I did know the prune study, yes. So it's about a 1%, I think it was a Penn State study that looked at it. It's about 1% difference in bone density for that. So, hey, it's better than nothing. So at least there's some evidence there.
Okay, thank you.
You're welcome.
And if I could build on that, because of course I listened to all of Margie's speakers, prunes have a lot of sugar, don't they?
Yes.
So you want their benefit for your bones? Do you want it for your diabetic self? No. So one of the things that was suggested was to soak the prunes, and I'm very frugal, and then to discard the liquid, because that's where so much of the sugar is, and you still get the benefits of the prunes, but not the excess sugar. So
That's a great idea.
it's a good idea. I'm not likely to throw away prune juice, but I mean.
Good point.
We'll have to see, though, if the study would have the same results at that point. Excellent. Well, we'll stick around for a few minutes in case anybody has any other questions.
Group picture. Let's take a group picture. Yeah, it's a group.